Well, you know, the new study that came out from the University of Michigan on retired NFL players and the fairly dramatic increased risk of dementia makes perfect sense to me. I've been concerned for many years that the NFL has said, well, we really don't know if this causes long-term brain damage, and I'm a brain imaging person. You know, we've now looked at over 52,000 scans, and it's very clear to me that people who play professional football at a high level, who've played 4 years in high school, 4 years in college, and whatever number of years in the NFL, that they've had upwards of 25,000, bangs to their head. And it's got to do something that's terrible. And it's like, well, of course, we should be doing a much better job of taking care of their brains, because if you don't take care of their brains, they're not going to be able to take care of their life. Well, the Michigan study said that people who played in the NFL, who were young, between 35 and 50, had a 19-fold increase risk. Now, it's a very small risk factor if you're young to have something like Alzheimer's disease. It's like 0.1%. And so, even though it doesn't look like a big number to, have a 2% increase risk for Alzheimer's disease, it's a huge number. And it's a 6-fold increase after the age of 50. And that's a stunning number. I'm in the middle of doing a very large brain imaging study on retired NFL players. And I expected it to be bad. And it's been shocking, quite frankly. And we not only do the imaging, we also do neuropsychological testing, and we do very specific memory testing and concentration testing. And compared to our normal population, there's clear evidence of trouble. Although, one of the most exciting things that we've seen, because my interest is not just to document that playing football in the NFL is a brain-damaging sport. I think most ninth graders would understand that. What we're trying to see is, can we rehabilitate these brains? Can we make these brains better? I mean, after all, my interest as a physician is not just to tell you that you're troubled. It's to see if I can't make a meaningful difference in the quality of your life. And the exciting news so far is that we have seen some significant, meaningful improvements in their cognitive ability. Well, what we do to try to be helpful as part of our study is to clearly evaluate them, both from, we do a blood flow study called SPECT. We do an EEG study where we look at the electrical activity in their brain, and then we do a whole series of neuropsychological tests. So it's understanding what the brain is. And then we do actually some very simple things. We put them on a great multiple vitamin. A lot of people don't know more than half of the players in our study are obese, that the incidence of being significantly overweight is very high. In addition, we put them on fish oil. And what we've found, many of the players have told us that they've either stopped or significantly lowered their pain medications on fish oil. And fish oil has very good scientific evidence of being an anti-inflammatory. Also, the DHA that's found in fish oil, one of the omega-3 fatty acids, has been found to decrease beta amyloid plaque formation. Those are the plaques thought to be responsible, at least in part, for Alzheimer's disease. So all of our players go on high quality, high dose fish oil. We then put them on some very specific supplements for their memory and for brain repair. And so far, so good. I mean, we're still in the middle of analyzing all the data, but it's a very exciting outcome. And I think we should think of it, if you hurt your knee, you rehabilitate it. You don't just rest it, you work it. You have to do the same thing for these players. And it's becoming very clear to us that anybody who plays high school football or college football, or certainly professional football, should constantly be thinking about brain health.